can I say that, first of all, as a Northern Ireland member, people may say, well, what input do you have on a debate which is about restrictions in England? The truth of the matter is, of course, that whatever restrictions are introduced in England tend to be replicated and indeed sometimes magnified by the Health Minister in Northern Ireland. And let me just give one example. In my own constituency, the lovely Carnfunnock Park, I could go for a walk through it today with a golf bag over my shoulder. But if I dodged through the hedge into the golf course next door, I'd be breaking the law, because the law was introduced here that golf would be, if you played golf, you'd somehow kill some of the population, so therefore you couldn't do it. And so the restrictions here will have an impact in Northern Ireland. Now, I could live with restrictions if they actually prove to be effective. But the very fact we're discussing another form of lockdown today for the 4th time, and the same arguments are being used. If we don't have it, the health service is going to be overwhelmed, we're going to have an increase in the R rate, we're going to have an increase in infections, people are going to die. And we've had lockdowns before, and yet we still have the same factors coming to the fore once again. It's hard to do controlled experiments, of course, with something like this, but the New England Journal of Medicine did do a report on an experiment that was done with Marines, where 2,000 were totally isolated and took all the restrictions that we have introduced here. And then the other 2,000 did not. And they didn't find any difference in infection rates. Not widely published, because, of course, some of the science around that, where it's contradictory, is not listened to. The second reason why I'm against the lockdown is because of the disproportionate effect it has on business. And if...
On that point, I thank the Honourable Gentleman, right Honourable Gentleman, for giving way. One of my concerns, and does the Honourable Gentleman share them, that for dentists who have followed the rules of face, space and distance and all the precautions, and the R rate is kept low, for barbers and hairdressers the same thing, where they've followed all the regulations and by appointment only, and their R rate is not 0.05. Does he not feel at this time, for those who follow the rules and do it correctly, they should be rewarded rather than stopped having their business?
Yes, and of course that's the frustration for many people, that they see their businesses being ruined by restrictions, even though, first of all, it can't be identified that their businesses are responsible for infection being spread, and secondly, they've taken all the precautions. And the number of small businessmen and women who have sacrificed their savings, who have given their lives to building up their business, who have taken risks with their own money, to find their businesses squeezed by the powerful hand of the state. It causes anger, and quite rightly it causes anger, to see people who get tossed out of their jobs by the same powerful hand, all on the basis that these restrictions are necessary. I think that we've got to ask ourselves, and it's significant, the government does not want to put beside the benefits of the restrictions on health the impact which it has on the economy, and we don't have that stark comparison being made, because of course if we did that we would find that a lot of questions would have to be asked. And of course we also have to remember that many other people who are suffering from diseases which could be cured, which could be treated and would save lives, but whose deaths will not be reported on the BBC in the daily death toll which we're given every night on the news. Those people equally have a right to ask questions. Why is the health service so distorted that our lives are not valued in the way that they should be? The third reason why I'm against this is because I believe that the methods we've introduced have led to a huge incursion into our personal liberties. And it's been done, many people have been amazed, how have people acquiesced? It's been done through Project Fear. And I've got to say, I've listened to ministers on the other side during the debate on Brexit, where they condemn Project Fear. Well, we now have Project Fear on steroids. There are people who are afraid to leave their houses. There are children who are worried when their classes close down that either their wee friends are going to die or they're going to die. That is no way to run a democracy, and that is no kind of policy that this Parliament should be supporting. And for that reason, I'll be opposing these measures tonight.